A New York City emergency room doctor on the front lines of the fight against the coronavirus has died by suicide.
Yeah, this has a lot of people wondering about the mental health toll the pandemic is having on healthcare workers all across the globe. And joining us now to talk about it is psychologist and assistant professor of psychology at Pepperdine University, Dr. Erlanger Turner. Doctor, thank you so much for joining us. And boy, this is a problem that a lot of us who aren't in the healthcare field may not know much about, but it is very, very serious, is it not?
Yeah, this is something that we've known about for a while in terms of compassion fatigue, and that when individuals are caring for others, oftentimes they may experience physical and emotional exhaustion due to caring for others. And this is one of the common concerns that often is experienced by doctors, nurses, and healthcare professionals.
If you have a nurse or a doctor or a healthcare worker in your family, is there some way that you can maybe detect that something is happening with them in case they can't express it to you, or something that you can notice where you can get help to them?
Yeah, I think it's really important that you sort of observe their behaviors. For many healthcare professionals, they oftentimes work long hours and long days, and I think that under these circumstances with COVID-19, that it makes it much more difficult maybe to identify some of the changes that may be going on. But if you notice that they are dreading going to work and they're feeling guilty about that because they are typically very excited about their career and helping others, that may be a sign that something is of a concern. If you notice that they are having difficulties sleeping, their diet is off, some of the common concerns that we may observe with people who may be experiencing depression or extreme stress, those may also be some challenges that may sort of warrant making sure that they get some help.
And Doctor, COVID-19 presents a unique challenge, I think, and yet please confirm this, but we've heard so many stories about nurses who have to be with patients who are dying because their families can't be there, and they're often the last people that they see before taking their last breath. What kind of a toll must that exact on the healthcare professional?
Yeah, that's definitely a difficult circumstance, and I think part of that is that when those individuals are there, it's possible that they may experience some secondary trauma from witnessing those types of things. So obviously, grief is something that they may encounter throughout their career on numerous occasions, but because of these extreme circumstances, it may be much more likely that they may be at a higher risk of developing things like PTSD or some form of trauma after witnessing these numerous events.
So, Dr. Turner, if you do notice something odd in your loved one or a friend who's a healthcare worker, what should you do? Should you approach them and tell them, hey, you seem a little off, or should you just refer them somewhere or call, a professional? How do you go about getting them help?
Yeah, I think one of the first things is that you want to encourage them to take care of themselves. So encourage them to make sure that they are getting enough rest. Obviously, for doctors, they are working extremely long hours compared to what they may typically work already. And so you want to try to encourage them to seek that support from friends and family to talk about some of the challenges that they may be experiencing. But I think you also don't want to push them to talk about those things because it may be a really difficult time for them right now. And so you may want to just be there to support them and validate the experiences that they may be going through. And I also think that you want to, as you mentioned, make sure that they are able to get some mental health services. And so encourage them to seek that support. For many organizations, they are offering healthcare providers free mental health services under this time period because we know that the stress levels are extremely high. And so you want to make sure that they are able to do that. And also I think it's important for healthcare systems to make sure that they are promoting psychological health as well, and making sure that they are monitoring for warning signs for people that may be experiencing compassion fatigue.
Well, you'd almost like to give them a hug, but you can't even do that these days, right?
Yeah.
Dr. Erlanger Turner at Pepperdine, thank you so much for those insights and information. Thank you.
Thank you for having me.